Hi, my name is Rena. I'm going to perform the HENT exam on you, okay? So first I'm going to look at your scalp. I'm going to look for any bumps, lumps, any scarring. Okay, now I'm going to check your temporal pulses. Good. Next I'm going to assess your cranial nerves. So can you raise your eyebrows, shut your eyes, okay, open them, and then smile, show your teeth, puff out your cheeks. Good. And can you frown? Next, I'm going to check your masseter muscle. So open, close, open, close, open, close. Good. Now I'm going to check the external structures of your eyes. So I'm going to look at your eyebrows, your eyelashes. I'm going to check your subconjunctiva and your sclera. So look up, look down, to the left, to the right. Good. Next, I'm going to check accommodation, EOMs, and convergence. Okay, so just follow my finger.
Okay.
Don't move your head, only your eyes, okay? Good. Next, I'm going to check your pupillary response. So I'm just going to flash this light in your eye. I'm going to dim the lights so you can see better. I'm going to flash this light in your eye, okay? So I'm going to check for constriction of the pupil. Good. And I'm going to check that the other is consensual. Give you a little break. I'm going to check the next one. This one constricts, open, and the other one is consensual. Good. Now I'm going to check the internal structures of your eyes, okay? So I'm just going to hold this up. Good. Open your eye for me. Okay. I'm going to put my left eye to your left eye, and I'm just going to look at the internal structures. So I'm going to look at the red light reflex, the disc, fovea, macula. Okay. A little break. Okay. Next one. Good. Okay. Next, I'm going to look at your ears, okay? So I'm going to look at the external structures of your ears. Good. Okay, now I'm going to do something called a whisper test. So I'm going to whisper 3 words, and then you're going to repeat them back to me one by one, okay?
Cat, dog, house, rat, white, blue.
Okay. Now I'm going to look at the internal structures of your ears, okay? Take my otoscope. I'm going to see, I'm going to pull the pinna up and back, and I'm going to look at the TM, no cerumen. Let's check this one, pinna up and back, no TM, look at the TM, no cerumen. Okay, good. Now I'm going to do the sniff test, okay? So I'm going to assess your nose. I'm looking for symmetry. Nose looks symmetrical. Okay, so I'm going to hold one nostril and you're going to inhale. Good. And the other one, inhale. Good. And now I'm going to look at the inside of your nose with the light. Good. Okay. Next, I'm going to look at your mouth, okay? So I'm going to look at your lips. Let me see your teeth. Okay. I'm going to use this tongue depressor. Okay. I'm going to look at your tongue, the soft palate and the hard palate. I'm going to look at the buccal mucosa. Okay. Stick out your tongue, say ah.
Ah.
And then I'm just going to gag you really quick. Stick out your tongue. Good. Okay. Next, I'm going to look at your neck and your lymph nodes. So I'm just going to look at your neck, see that everything's symmetrical, trachea is midline. Okay. Now I'm going to palpate your lymph nodes. Okay. So I'm going to touch the pre-auricular, post-auricular, posterior occipital, anterior cervical. Look at your submandibular, and your submental. Okay, good. Can you shrug your shoulders? Good. Okay, next I'm going to ask you to take a sip of water. Don't swallow it, and I'm going to assess your thyroid, okay? So just hold it in your mouth. I'm going to come from behind, okay? I'm going to tilt your head to the side and then down. Okay, swallow. Good. Take another sip. I'm going to tilt to the side and down and swallow. Good. Okay. That completes the HE and T. Okay. Next, I'm going to look at your lungs and your chest, okay? So, can you take your shirt off? Good?
Yeah.
Okay. Just grab the stethoscope. Okay. So, I'm going to look at the AP diameter. 2 to 1. Okay. And I'm going to put the stethoscope on you, and we're going to listen to your lungs, okay? So every time you feel me move the stethoscope, take a deep breath, okay? So we'll begin with a deep breath. 12. We're doing interior and posterior. Okay. Take a deep breath. I'm gonna do the same to the back, okay? Good. Okay. And that is complete for our lung exam. Next, we're gonna do your cardiac, okay? So, first thing I'm gonna do is listen to your carotid pulses with the bell of my stethoscope. So, feel them. Just feel the pulses first, one by one. One by one. Okay. I'm gonna listen with the bell of my stethoscope. Very strong. Okay. And this you can just breathe normally. I'm just going to have you lean forward, and I'm just going to inspect for any heaves. Okay, good. You can sit back. Okay. So I'm going to listen. So first you're going to sit up while we do this, and then I'm going to have you lay down and do the same thing, okay? You don't have to deep breathe, just breathe normal. And then the next part, I'll have you lay down. Good. And next I'm going to look at your abdomen, okay? So I'm going to listen all 4 quadrants. You can put your legs down. Okay. Good. I'm gonna look at your abdomen, okay? Good. Now I'm going to percuss all the way through, just around all 4 quadrants. Okay. Now I'm going to just check your liver, okay? So I'm going to percuss. Hear that dullness. Good. Now I'm going to palpate your liver, okay? So take a deep, deep breath. And exhale. For the liver. Any pain when I do that? Okay. Good. Now take another deep breath. Okay. Now exhale. I'm going to palpate, okay? I'm just going to push around. Tell me if you feel it. Palpate. Okay. Any pain when I did that?
No.
Okay. Okay. Next, I'm going to feel your upper and lower extremities, okay? So I'm going to look at your hands and your feet. Let me just okay. So put your legs flat and your arms and your legs. Okay, that's good. The patient's laying supine. Okay. Good? Okay, that's good. Okay. I'm just gonna feel the temperature. Feel your temperature. Okay. Temperature feels good, color looks good. I'm gonna feel your brachial pulses. Good. And I'm gonna feel your radial pulses. Okay. Next, I'm going to feel your femoral pulses. Okay. And I'm feeling also the color. And I'm feeling the tibia. For any edema, which I don't feel any. Okay, Next, I'm gonna check for the popliteal. Just bend that. Okay, this one, bend. Okay, and I'm gonna check your posterior tibialis. And your duralis penis. And let me just see the capillary refill of your fingers. Okay. Good capillary refill. And of the toes. Good cap refill.